Hey, how are you? Do you know solving question is one of the best way to pass the MRCS exam? We will discuss all the question of eMRCS, Fawzia sheet, and recalls. So stay tuned with us by subscribe our channel for next interesting videos, which will help you to pass the MRCS exam. Here is another question. Let us start the question here. A 43 years old man undergoes a cadaveric renal transplant. The operation is uncomplicated. On removal of the vascular clump, the transplanted kidney immediately turns dusky and over the ensuing hours appears non-viable. Which of the following best explanation of this event? Here we can see the a 43 years old man undergo cadaveric renal transplant. That is up to this point is okay. The operation is uncomplicated. That means operation is fine. Anastomosis is okay. Anastomosis in 3 points are okay. On removal of the vascular clump, so vascular clump, transplanted kidney immediately become dusky and it becomes non-viable with these hours. So here first of all operation okay, no complication there. The second one, vascular clump when removed, kidney immediately turns into dusky. That means kidney is being damaged and finally proved that it was non-viable. So it is within the short duration of the time. So what is called of this event, or which of the following best explanation of the event? Here the options are chronic rejection, hyperacute rejection, acute rejection, subchronic rejection, and infection of the graft. So here there are different options we can see. First of all, chronic rejection, as it is occurs during the operation or very early, so there is less chance of chronic rejection. Hyperacute rejection may be, and acute rejection. So acute and hyperacute rejection, among these 2 points there may be answer. And subchronic rejection, as this is very early and within that hour, so there is less chance of chronic. And infection of the graft, and it is not possible for to be infected within the short period of the time. So our answer will be within the 2 points. So here we can see the graft rejection. There are hyperacute, acute, and chronic. Hyperacute, it is immediately due to, and immediately occurs due to presence of preform antibodies such as ABO incompatibility and other incompatibility who is in which antigen antibody reaction occur and graft rejection occur. So hyperacute, it occurs immediately during the operation, on the operation table, or within a very short time of the operation. The second one is acute rejection. It occurs within the first 6 months. And third one, chronic, it occurs after the 6 months. So hyperacute, acute, and chronic. Hyperacute occurs immediately during operation, acute occurs within the first 6 months, and chronic, it occurs usually after 6 months. And acute, it occurs due to within the first 6 months due to tissue infiltration and vascular lesion, due to tissue infiltration and vascular lesion. And the chronic, or last one, it occurs after the 6 month, and it occurs due to vascular changes. We can see another phase here, the graft rejection, hyperacute, acute, and chronic. The timing: hyperacute immediate, acute less than 6 months, and chronic graft rejection, it occurs more than 6 months. So hyperacute, it occurs due to antibody against donor HLA type 1 antigen, and these antibodies are preformed. So when transplantation complete, when vascularity is reversed, then antibody goes to the donor's kidney, and antigen antibody reaction occur and rejection of the graft occurs. But it rarely seen in HLA matching or HLA mismatching. In case of HLA mismatching, the rejection occurs very gradually. Then acute graft rejection, it occurs within the first 6 months of the transplantation, and it usually occurs due to mismatch HLA. Due to some point of the HLA, if there is mismatch, then it gradually graft failure occurs. Other causes include cytomegalovirus. This point is very important, and that within the 6 months one infection is very important, that is cytomegalovirus. So cytomegalovirus, it causes infection within the first 6 months following the transplantation. And management in case of acute graft failure, first of all, giving steroid response almost all of the time, but if resistance, then monoclonal antibody may be given. Then last one is chronic graft failure. In case of chronic graft failure, the time after the 6 months of the implantation or graft implantation or organ implantation, and it occurs due to chronic allograft nephropathy, ureteric obstruction, and recurrence of original renal disease such as mesengiocapillary glomerulonephrosis, IgA nephropathy, focal segmental glomerulosclerosis. So here are the rejection: hyperacute, acute, and chronic. Hyperacute occurs within the operation table or immediate after operation, and acute graft failure, it occurs gradually and within the 6 months, and chronic graft rejection, it occurs very gradually after the 6 months. And there are different causes of the rejection. In case of acute rejection, due to preform antibody, in case of hyperacute rejection, it is due to the preform antibody. In case of acute graft failure or within 6 months, due to an infection, cytomegalovirus infection, and HLA mismatch. And chronic rejection, chronic allograft nephropathy, and ureteric obstruction. So here our final answer is hyperacute rejection, because we can see here immediately dusky and upon removal of the vascular clump. So in the operation table, when vascular clump is removed, immediately kidney become dusky and kidney appears non-viable. So as this is in the operation table, it occurs, so it is called hyperacute rejection. In case of acute rejection, it is a slow process and it occurs within the 6 months. And chronic rejection, it also a slow process, but it occurs after the 6 months of the implantation. Subchronic rejection, that type of classification not present. And infection, which is not possible, because for infection there usually required 3 to 5 to 7 days after the operation. So there is no chance of infection here. Thank you all.